Okay, Sharon, let's start. We talked yesterday about using AI clinical coach today. Are you okay with that?
Yes, absolutely. Thank you.
I'm hitting record.
Okay, so this patient is a 3-day-old full-term infant born to a 32-year-old G1P1 via normal spontaneous vaginal delivery, no complications. Mother had no problems during pregnancy. Prenatal care was complete. The baby developed a fever yesterday. No other signs or symptoms with it. So we drew a blood culture, we did an LP, and then sent off a CSF culture, and then we started ampicillin and gentamicin. This morning, he seems clinically okay. He doesn't look sick. He's starting to breastfeed a little bit. There's no more fevers. The vital signs seem normal for age. The blood culture came back positive for Canada. So I already ordered repeat blood cultures, an ophthalmology exam, an echocardiogram, abdominal ultrasound, and immune studies. My plan is to start fluconazole. So what do you think? What else should I do?
Sharon, I'm going to stop recording now.
Okay, thank you.
Yesterday when you drew the blood culture, did you think about what result you might expect from that blood culture?
Not really. I mean, I guess bacteria. But when I saw Canada, I was pretty worried. They can be pretty serious in newborns, so I thought I'd better do a dissemination workup and start treatment. So I talked to the lab, and they told me that the baby does not have Candida. The blood culture is actually negative so far. How did you know to double check?
Well, Sharon, I asked you to call the lab and double check the blood culture because the story didn't fit with the new finding of Candida. So let me show you. When I'm trying to solve a patient problem, I try to remember to use the elements in the thinking habits matrix when I think about a patient. So what I did was self-reflect on the new data that you gave me.
So if I had asked myself, what do I expect when I got that blood culture, then with the Candida result, I might have thought that that was kind of odd because I was actually expecting bacteria, right?
That's correct. And you might have at least paused.
Yeah.
Or you could maybe have called to ask me to discuss the case.
Right.
But instead you assumed that the Candida finding in the blood culture was real and you proceeded to plan a lot of interventions. That's a big deal for a 3-day-old baby and his parents.
It's true.
Here is the clinical coach report. The bot gave you several suggestions of things to work on. I agree with the bot that some work on self-reflection, on interpretation would be good. Okay. And it also suggests working on self-reflection on solution, and I agree.
Yeah.
Okay. So for the remaining patients today, I would like you to ask yourself, what do I expect each time you order a test? And when you present the next patient cases, I would like to hear what you expect.
Yes.
What do you think about that?
Yeah,
Do you think I can do that?
I think I can definitely try.
Okay, great. Did you see a new patient?
I did. Okay, so this patient is a previously healthy 5-year-old. He's got 5 days of knee pain, and it's getting worse. He won't walk anymore. I think what I'd like to do is get a blood culture, and I'm expecting to find bacterial growth in this culture because that would be the most common cause of a joint infection. But for treatment...
Wait, Sharon, let me stop you there. Okay. I just wanted to let you know that I noticed that you articulated your expectations for the tests you ordered, and you did it without any reminding or prompting from me. And it looks like it's starting to become a habit.